Day one of new patient orientation, which is a multi-step process. Next slide. So first off, the patient will come in and fill out a PGIQ or whatever equivalent you're using. While they're doing that, you can have your CA check their insurance info and get a copy of the driver's license. And then once they've filled out their paperwork, you can take them on an office tour. One thing I've seen done on the office tours that works really well is if you set a little spot aside and get a view box, and then pick a patient of the month and do a pre and post lateral cervical and draw in like the healthy lordosis. That's a great visual just to kind of have that light bulb moment when you're initiating them into what we really do, the arc of life, and how important that is. So after that, you will take them to the neurological chiropractic assessment room, which is a really, really awesome way to say exam room. So this is where the rest of the day one will take place. You'll look at the PGIQ, and you'll enter and greet the new patient with a double handshake. So if I could borrow our lovely assistant, Ms. Melissa Town, to demonstrate this, because this can make or break the other new patient orientation. We hear it for... So double-handed handshake. So, hi, Melissa, I'm Dr. Dane. That's wrong. You totally blew it. Double-handed handshake. Hi, Melissa, I'm Dr. Dane. So nice to meet you. Patient for life. So that's critical. And then, yeah, physical exam, x-rays, and you would have them come back for your official report and review of findings.
Okay, everybody, I'm Tim. Basically, the reason why we're talking about this, because we want to get you guys fired about chiropractic, because that's what we came to school here to learn. 60% of chiropractors out there practicing right now are within 3 months of closing their doors. So you want to stick to what we've learned at this school, which is chiropractic. And so I'm going to start off the day one with what you would do. I've been the one walking in, giving the double handshake. From there, I'm just going to act like you guys are all my patients. So I have a huge exam room. And so from there, it's going to be, well, I've reviewed all your guys' paperwork, and I can see you have a lot of health concerns going on. But right now, we're going to set those aside. We're going to talk to you a little bit about how your body functions and how we're going to help you with your health concerns with specific scientific chiropractic care. And so there's something in all living things. It's in the trees, it's in the plants, it's in the animals, it's in you and me. For instance, right now, your heart is beating, and you're not having to think about it. Your lungs, they're breathing. They're supplying all your cells with the oxygen they need, and you're not having to think about that, are you? So what that's called in science is called innate intelligence. And what that basically means is just inborn intelligence. And so when your father's sperm and your mother's egg came together, those two cells divided, and the first thing that formed was your brain and spinal cord, which is the lifeline of your body. So that is where, like I said, innate intelligence starts. And so from there, your cells keep dividing. Now we have you. Isn't that great?
Woohoo!
Sweet. So what we have here is a model of your spine. And so up in your skull sits your brain, and that is where 100% life comes. So your brain sits in your skull, and it comes down through this hole in the bottom of your skull called the foramen magnum. Now, the extension of the brain that passes through there is called the brainstem, and it sits in between that first bone in your neck, which is the most important bone in your entire spine, and it's called the atlas. Can you say that with me?
Atlas.
Very good. So the reason why that bone is so important is because 78 trillion nerve fibers pass through there, and it becomes your spinal cord, and it comes all the way down and attaches to your tailbone. Okay? So that is a principle of life. So your brain sends that 100% health down your spinal cord, from the spinal cord, out. All these little nerves right here, they go to every cell, tissue, organ in your entire body. And so that principle of life is above, down, inside, out. You guys got it? Can you say that with me?
Above, down, inside, out.
Sweet, now you guys know how 100% health comes to the body. Chris is going to talk to you a little bit about how do we get interference in that message.
All right, you guys, you see what can happen is these bones can misalign in your spine. And what do you think's happening to that nerve when those bones misalign? It's putting pressure on it, right? And what do you think's happening to that message going from the brain down that spinal cord and out that nerve to that specific organ or cell? It's not getting through like it should, right? Now, in science, when two or more of these bones misalign, we call it a vertebral subluxation complex. So a subluxation causes nerve interference, okay? And in science, it says that you can have a subluxation for up to 10 years before you experience any signs or symptoms. And for you guys to be experiencing symptoms, we know that the problem has been there for a very, very long time, and it's going to take time and repetition for us to fix the problem. Can you guys say time and repetition for me?
Time and repetition.
Very good. Now, how we fix it in this office is we use specific scientific chiropractic adjustments to gently realign those bones so that your body can function from above down, inside out, like it's supposed to. Now, we have a saying in this office that Rome wasn't built in a day, your symptoms didn't arise in a day, and again, it's going to take time and repetition for us to fix those problems. See, proper structure, as I just explained, equals proper function. Make sense?
Yeah.
All right, can I get the hand? All right, so this right here, this is a chart of your nervous system. In this office, we see people with misalignments in their neck region causing nerve interference to the head, their ears, the sinuses, causing sinusitis, allergies, headaches, migraines, ear infections, vertigo. We also see people with misalignments in the mid-back, causing nerve interference to the heart, the lungs, the stomach, causing high blood pressure, irregular heartbeats, breathing difficulties, asthma, stomach ulcers, digestive problems, right? We also see people with misalignments in the low back, causing nerve interference to the kidneys, the bladder, the lower digestive tract, the reproductive organs. This can lead to, digestive issues, constipation, diarrhea, kidney stones, bladder infections, infertility in men and women. Now, all these nerves also go to all the muscles and joints in your body, so it can lead to aches, pains, and numbness and tingling. Now, we are concerned with your aches and pains. However, we're more concerned with how your body is functioning, because as I said earlier, proper structure equals proper function. Now, Tony's going to tell you a little bit more on how you guys get these subluxations.
Tony!
We know about nerve interference. Now we have to know, well, how does it get there? So we identify, subluxation nerve interference. The causes are the 3 T's: thoughts, traumas, and toxins, right? Everybody, has an idea of what those could be. So the first would be, our thoughts. The emotional stress, whether it's stress from our jobs, our relationships, our finances, well, it causes nerve interference, causes subluxation within our spine and our nervous system. The second would be the toxins, the food we eat, the water and the beverages we drink, the air that we breathe, the toxins from the medications that we're taking that we use to cover up our symptoms when we don't correct the cause of our health problems. And the last T would be traumas. So we have big traumas and little traumas. So big traumas would be, the car accidents, the slips and falls, the old sports injuries. I think we all have experienced that before in our lifetime. But the main ones are the micro traumas. Standing on a hard surface, a concrete surface all day long, 8, 10, 12 hours of work. Driving an hour or more to work every single day. Being at a computer in this position all day, texting. Our kids carrying book bags. Us, we're all carrying book bags. It's repetitive microtraumas in the spine causes subluxation, causes nerve interference. But the main cause of a subluxation happens in many of us right at birth. In this country, 85% of women are receiving epidurals. And they're receiving epidurals so mom doesn't feel pain, and that's great. Mom has no pain, but guess what? Mom is now numb from the waist down. So when mom needs to push to get the baby out, how do you think that happens? If mom can't feel. She can't feel when it's time to push. So in this country, we've gone from a standing, squatted, or seated position to give birth, allowing the pelvis to open up, gravity assists the birthing process, so now mom is laying on her back, pushing up against gravity. She can't feel when it's time to push. So how do we get the baby out? Well, the doctor has to intervene. And the doctor can do that in several ways. The first way is using forceps. So the forceps are clamped around the baby's head and neck, and the doctor twists and pulls the baby's head out.
Ouch.
That happens.
That's true. So the next, which is more common, is vacuum extraction, where a vacuum is placed on the baby's head and neck is again twisted out. If those don't work, the doctor has to intervene by doing a C-section, where mom's belly's cut, the doctor comes in, pulls the baby by the head and neck out of mom. Now, it's so traumatic on the baby's head and neck, all three of those examples, that the research actually, it states it's equivalent to a grade 2 whiplash injury in adults. So now that the baby's out of mom, doctor hands mom the baby and says, what? Congratulations, support the head and neck. It's the lifeline of the body. But what did they just do? Exactly. That's why it's so important that kids get checked right away. That way they can grow up to be as healthy as possible, and they don't have to go into drugs, the medications that many of us are on. So guys, in this country, we've been misled to believe that our health comes from inside out. And we know that the body's principle of health and life come from above down, inside out. Sorry, we're misled to believe that health comes from outside in. Yeah, outside in, right? Drugs, surgeries. So, in this country, we spend $2.7 trillion every single year on drugs and surgery. We are, in the United States, 3% of the world's total population, yet we consume 70% of the world's total drugs. So if we spend the most money, if we're taking the most medications, and that's the solution to our health problems, how should we be doing?
Great.
Yeah, but how are we really doing, guys? Yeah, terrible. We're not addressing the structure. We're not addressing our true health problems from above down, inside out. Are you guys ready to get to the cause of your health problems?
Yes.